Facing at least 2 more weeks of restrictions in Alberta and similar, if not longer, measures in other provinces right across the country, the quest to get one's hands on the COVID-19 vaccine is becoming more desired. However, there are concerns about supply keeping up with demand. This as the number of COVID-19 cases remains high. And news today that the province has added over 13,000 people to its priority vaccination list. Alberta has found 1,183 new cases of COVID-19 from over 16,000 tests for a positivity rate of just over 7%. There are roughly 13,600 active cases in the province, with over 4,800 in the Calgary zone. 851 people are in hospital, 135 of them in the ICU. 24 more people have died for a total of 1,241 across the province. When it comes to the vaccine, yesterday's number of doses administered has not been updated, and we don't know how much supply the province has either.
That's the subject of tomorrow's news conference, so we're still updating our numbers and projections in that regard. But let me say that we are concerned that as we pick up the pace of inoculation, that the supply will be inadequate.
That was Premier Jason Kenney Thursday afternoon, not wanting to get ahead of himself when it came to the supply and demand of vaccines in this province. However, 24 hours later, the update on vaccinations canceled. The Premier's office now saying there have been some supply issues and they want to wait until they have all the numbers before speaking, pushing the next update to likely Monday. The Alberta NDP is calling for a better flow of information on the vaccine rollout.
Albertans deserve answers. So our caucus renews our call for daily online reporting of vaccinations administered on a regional basis, the inventory levels in Alberta, and anticipated incoming shipments. Because frankly, a transparent vaccination program with a clear timeline should be the highest priority for Jason Kenney.
The only new information released by the province on vaccines today is that healthcare workers in medical, surgical, and COVID-19 units can now get an appointment to get the shot. So this means about 3,300 COVID unit staff and 15,400 medical and surgical unit staff are now eligible. Chief Medical Officer of Health, Dr. Dina Hinshaw, also says that doctors, nurses, and pharmacists that aren't AHS employees can also deliver the vaccine. Meantime, a new variant of COVID-19 that first surfaced in South Africa has now been found in Alberta. Dr. Dina Hinshaw making the announcement in a tweet about an hour ago. While no one from the Public Health Agency of Canada was immediately available to comment, the case could be a first in Canada. Officials had said as late as Tuesday that the new variant had yet to be detected in Canada.